啱好夠人啦，咁我哋咧就係可以嘅。
All right, members, it is about time to get started. Shall we invite the administration in? The first item is about the information paper. There is a referral from the Wong Tai Sin District Council regarding the Maryknoll Hospital. Items for the next meeting, please refer to the list of outstanding items. If everything goes smoothly, it will be the 26th of February, just before the Lunar New Year. The first item is research study on regulation of aesthetic practices in selected places. We have read this booklet. We had an informal meeting devoted to it. There are two items proposed by the administration. The first one is the private patient services provided by the teaching staff of the two universities. The second one is the progress of the GOPC PPP program. All right, unless you have any contra views, we proceed accordingly. Item 3, briefing by the Secretary for Food and Health on the relevant policy initiatives featured in the policy address. I think this will take us to 6:30, and then we spend the remaining 30 minutes on the UCH, United Christian Hospital. Secretary, do you want to have any introduction? All right, there are 6 members: Ms. Wong Kwa-hing, Dr. Kwok-Kai, Helena Wong, Pun Siu-ping, Yu Si-wing. 5 minutes, please. Mr. Wong Kwa-hing, Chairman. Secretary, I've got 2 questions, if I may, regarding the policy address. The first one is the elderly dental assistance program, and if I may refer to your brief, this will be phased in for the elderly people, and that the OALA eligibility criteria is 70 years of age. Now this will be extended in phases. For the first phase, this will cover those aged 80 and above, and 130,000 senior citizens will benefit. Can this be speeded up? And how soon are you going to cover those aged 70, those eligible for OALA? I wouldn't say that you should expand it further. Now, the first phase covers those aged 80. Chairman, for senior citizens, it is most distressing for them to see the program and not be able to enjoy it, and this is very distressing for them. How many stages are there before you would lower the age threshold to 70? Second, about the outpatient clinic public-private partnership, there are 3 districts that are covered for pilot scheme. Now this will be extended to the 15th district in phases. How soon are we going to see this materialize? And according to some reports, the 3 districts under the pilot scheme didn't yield pretty good results. The objective was to cover 6,000, but it falls short of expectation. Secretary, please. Chairman, thank you for the first question. There is a need for us to phase in the program because, as you're aware, dentists in Hong Kong are private practitioners, most of them. So we have to do it through the Hong Kong Dentists Association to attract more dentists to be part of this scheme before this will materialize. So for the time being, we can only start with the 80 euros. We fully appreciate that there are other categories or age brackets that are also needy, but we would like to cover those who are more senior in ages and they are suffering from more dental problems. I hope that this will be understandable. As to how soon we can extend these to other age brackets, we will have to build up the experience first. Once this has been rolled out, we have to have a certain number of dentists taking part. We have to build a critical mass of dentists who would be able to serve the elderly population. We see how the number will build up and whether we will be able to attract more dentists to take part. So for the time being, it would be difficult for us to say how soon other age brackets would be able to be covered. For the second question, perhaps I defer to the hospital authority to address it. Chairman, if I may respond to members. Now we're going to have a special topic on this item next time. The scheme has been going on for about 6 months. Our plan is to have the pilot for 2 years and then see how we take it from there. We hope that 6,000 people will be taking part. Now we are a quarter of the way through the program. We have had 2,300 taking part, and the progress is considered satisfactory. There will be an interim review by the middle part of the year as to what district will be extended to and the pace and so on. We will wait until the review. Perhaps we can bring members up to date at the next meeting. Mr. Wong. Chairman, now for the PPP, I hope that the administration might wish to make a response. We don't want to see a situation where the members of the public lose confidence in the scheme. I hope also that more dentists will be lured into the scheme. Dr. Kwok. Chairman, healthcare is a broad subject. I'm disappointed with the hospital beds. I understand from the hospital authority that during the height of the flu season in winter and so on, there is a lack of hospital beds, 15, 16. There will be an additional 250. Now, with the aging population, it's outpacing the rate of increase here. Thus, the administration have a longer-term plan. Now, Secretary, you remember that previously we had 6 per 1,000. Now it is 2.69. It is worse than 30 years ago, and it is wholly disappointing. Second, regarding the general outpatient clinics, you have more episodic quota like the cold and common cold and so on, and how many additional discs will be involved, and also geriatric health care. At the PAC, the members are criticizing the government on this, and the geriatric care is given a pretty low priority. Now the waiting time is something like 60 months, about 5 years, and more resources are devoted to the senior citizens and the dental care for the elderly. Now, it is ridiculous for you to start with 80 euros. The Dentist Association did conduct some study at the age of 65, those who are suffering from cavities and those dentures, the problem is getting serious, and it seems that the government is really dragging its feet on this. Is it possible for the government to provide outreach services or dental services for the senior citizens? Now, the 80 euros may find it difficult to go to the dental clinics for treatment. Perhaps for the 80-year-olds, you can provide extended outreach services, or perhaps you might wish to lower the threshold to 65 years of age. Secretary, a number of beds in the coming 20-30 years, given the growth in population, and the population is aging. We look at the size of the population in different clusters and increase the number of beds under the hospital authority. Now, we did provide a report to the council outlining a blueprint for the coming 20-30 years. Given the aging population, we're going to increase the number of beds in different districts. And at different stages, we will bring the panel up to date on a regular basis. Let me cite some examples. Now, the KTD, Kai Tak District Acute Hospital, this has been announced in the policy address. In NT East, for instance, we do have a plan, as we explained last time. At PWH, we are planning for the second stage of expansion. In NT West, we are in the process of building the Tin Shui Wai Hospital. Now, we are looking at the land in the vicinity for expansion purposes. In terms of planning, the Tin Shui Wai Hospital has only 300 beds. With this scale, it is difficult for the hospital to be fully serving its purpose. So there is going to be a plan for expansion at different clusters, depending on the needs. So we do have to plan to expand the number of beds. My colleague can supplement later on. Now, during the seasonal peaks, there are indeed measures to provide temporary beds to meet the demand. Also, episodic care, I defer to the hospital authority for follow-up. Dental care for the elderly, as I said just a moment ago, we did have a plan, we did have a mode of operation whereby we provide outreach and services, but that would cover the RCHEs. The NGOs do provide outreach teams. In this particular program, we're dealing with the senior citizens in the community. We do not resort to the outreach service because with an outreach service, we can only provide the basic examination, and the elderly will still have to go to the clinics for certain treatment because of the requirement for certain devices. Now, the NGO staff will be escorting the senior citizens to the clinics for treatment if they see the need for this to happen. As to whether we can lower the age threshold, we do wish to do so, but at this point in time, the number of dentists taking part is not able to let us do this.
And in fact, we're already working with the Hong Kong Dental Association regarding this project. As for the targeted age groups, this is the outcome of our discussion with them. A long queue for elderly services. Well, I'll defer to my two colleagues. Well, let me supplement, Chairman, on the GOPC quotas. In the past years, we have been increasing quotas. In 2013-15, we have 45,000. In 14-15, we have 52, and we plan to increase the quota to 55,000. Depending on the supply of manpower, we hope to further increase the quotas in 2016-17. Elderly Health Center, we have accepted the auditor's recommendation, and we're going to conduct a review. Earlier, we have strived for resources for this year and next in Sha Tin and Wan Chai health care centers. We're going to increase manpower. Dr. Helena Wong. I have two questions. First of all, I agree strongly that the government should strive to shorten waiting time for various healthcare services. However, according to what you say in para 5 and para 6, I'm really worried because the solution that you're providing is to increase the working time of healthcare personnel by providing them with a special honorarium, and also to increase the number of operating theatre sessions. But I think the best solution is to increase healthcare staff instead of asking your staff to work overtime, to have more consultation sessions and to do more operations. Have you conducted any survey on whether the healthcare personnel is actually willing to work overtime for longer hours or to hold more sessions? Have you understood their opinion, whether they would like to work overtime and whether the quality of service will be affected? Now, I don't see any concrete or specific proposal to increase manpower. Is it the case that manpower would remain the same despite additional consultation or operating theatre sessions? Yes, I'll defer to my HA colleagues. Thank you, Chairman. Yes, the waiting time is long. As far as manpower is concerned, in the coming year, for new graduates who have just undergone internship, we have recruited all of them. As for doctors who have just undergone the licensing examination, we will recruit them as well, and we anticipate that there will be 420 new doctors. Well, in the coming years, and in fact, we've just increased the number of places for medical students from 250 to 300, and by 2018 we'll further increase to 420, and we hope by doing so we can increase manpower. Of course, increasing manpower is one of what we should work on to shorten waiting time for certain clusters and specialties such as orthodontics. Those specialists may be willing to work longer hours, and for some other specialties we have other measures. We have increase in manpower. For example, we also have a triage system to shorten waiting time. Additional operating theatre sessions is important because if the patients cannot receive operations, then they'll go back to consultations repeatedly. So this will also be worked on in order to shorten waiting time. Is it because there is a lack of supply of doctors in the private market? That is exactly the case. So have you considered recruiting overseas doctors to practice in Hong Kong? We have been doing that in the past few years. This is one of our initiatives, and also the Medical Council has provided twice instead of 2 examinations instead of just 1 examination each year as far as licensing examinations concerned. Now we've recruited about 300, and this year in 2015, because we have more graduates and we have more doctors undergoing the examination, the number has increased from 300 to some 400. And for the hospital in Kai Tak District, it's said that a new acute hospital will be built. Funding has been allocated for a children's hospital to be built. And for the acute hospital, in the first phase, an oncology center will be provided first. And what about the second phase? When will it be completed? The children's hospital is not the same as this one. For the children's hospital, yes, the electrical has approved funding. It's now under construction. This is expected to be completed in 2017, and in 2018, by phases, it will be commissioned. As for the hospital in Kai Tak, it it was just announced in this year's policy address, and we are planning for services in the phase 1 of the hospital. It is an acute hospital in Kai Tak. Subject to completion of phase 1, we'll then discuss with the administration as to when phase 2 will be completed. But that doesn't mean phase 2 won't commence construction until completion of phase 1. And there are reports saying that A&E services will be provided. That means after we set up the oncology center, we can alleviate the overcrowding for the inpatient service in Queen Elizabeth Hospital. So overall speaking, the Kowloon East cluster can be improved, and perhaps we can report back next time, because we will look at the progress of the hospital in Kai Tak, and then we'll report more details to members as regards the whole cluster. Mr. Boon Siu Ping. Thank you, Chairman. I'd like to follow up on the waiting time as well. Well, the paper sets out measures to improve waiting time for healthcare services, and I'd like to know more about that. What is the target that the government has in mind? Because just now we talked about increasing manpower, and there will be additional emergency wards and additional consultation sessions, which are good news to the public. My question is this: will these additional wards and sessions affect existing services elsewhere? And in the policy address, 2 committees will be putting forward their recommendations. One is a committee on review of the HA's operation to look at the clusters, cost effectiveness and resource management, etc. The other committee has to do with a steering committee on the strategic review of healthcare manpower planning and professional development. I'd like to know their progress. They're going to submit reports within this year, but when within this year are they going to put forward their recommendations? Secretary, let me deal with the last 2 questions first. For the 2 committees, their work is quite different. For the Committee on the Review of HA's operation, it has to do with management and utilization of resources review. And the review is by and large completed. We're in the process of compiling the report. And we also need to incorporate views collected in public fora and a public consultation exercise. So it's expected to be completed in the middle of this year. Those recommendations are to do with concerns expressed over HA's operation. For example, the management and personnel management across HA's clusters, and whether better coordination can be implemented. And also internally, on allocation of HA's resources, whether more emphasis will be placed on the district population in the cluster, because we have received criticisms about this. For some clusters, it covers such a huge population, but the resources allocated to that cluster is disproportionate. So, like I said just now, those recommendations will be based on these concerns. As for the review on manpower planning, the situation is more complex. It has taken longer time than the other committee to review HA's operation, because different disciplines and specialties are covered, including doctors, dentists, etc. And we have completed the core part, which is about medical doctors and nurses, and a report should be ready by the middle of this year. As for other healthcare professions, they are still not yet ready. And for the other parts of your question, perhaps I will defer to Dr. Leung. What is the target? By how much should it be improved? And will existing services be affected? Thank you, Chairman. For more resources deployed to shorten the waiting time, as mentioned just now, some doctors are given special honorarium for working overtime and for additional emergency wards. We expect that additional consultation sessions can be provided during weekends or non-peak hours, and we hope to increase the number of consultation sessions by 3,180. As for SOPC, we give priority to urgent cases ranging from 2 weeks to 8 weeks. For non-urgent cases, we do not have any target waiting time, but we rely on the triage system. For non-urgent cases, the waiting time will be longer. But as I said just now, we are going to increase manpower and we seek help with medical family clinic services, and we hope by doing so the waiting time can be shortened. Mr. Alice Mack. Chairman, I have a question for Secretary. Well, he said that in the middle of 2015, in relation to the voucher scheme, elderly health care voucher scheme, a comprehensive review will be conducted, and I'd like to know what the review will be about. Will it be about decreasing the age threshold from 70 to 60? And as I asked before, we asked whether the EHV scheme can be extended to Guangdong province so that elderly people living or Hong Kong residents living in Guangdong can also benefit from this scheme. And I'd like to know whether there is any progress. And in parent 190 of the policy address, there is also a paragraph on expanding the drug formulary. I don't know whether it means we will use existing mechanism and introduce new drugs to the drug formulary, or are you going to expedite the process? Because many patients criticize the slow progress of the expansion, and also whether more patients can benefit from that, especially for needy patients. These two questions first. Chairman, on the review on the elderly healthcare voucher scheme, let me put forward some principles, and if necessary, the DH can supplement. I think the review will entail two components. One on its operation, because there have been operational problems and technical problems regarding this EHV scheme. Well, some problems have been addressed. For example, in the past, because of technical difficulty, we require that the voucher amount to be of a certain denomination, and that there could be no change. And it means when an elderly patient consults a doctor, if the if the expenses does not tally with the voucher amount, the elderly patient may need to make a co-payment. But now we have adjusted the voucher amount down to the roundup of $1, which means that the user can pay the exact amount, assuming that he has sufficient balance in the account. And we are also looking at other operational issues.
Well, it all depends on how many senior citizens will be using it and how many healthcare workers are taking part. The second one is the coverage. Now, we have to look at the actual operation, the amount of resources that we have devoted, and see whether the coverage can be further expanded. And the age threshold can be looked at that particular stage. The review will cover every single aspect. Under the Guangdong scheme, in principle, we are moving in this direction. But there are still technical issues to be sorted out. It would be easier for those who are in Hong Kong. The vouchers will go into the senior citizens' accounts, and when they take part, everything will be linked up in the computer system. If they have the credit in the account, and they go to the medical practitioners, and that would be handled by the computer. But it would be a different issue with cross-boundary issues, like whether the computer systems are linked up and the exchange rate and so on. Ms. Alice, how soon would this happen? You talked about this last year, Secretary. We hope that we can do it as soon as possible. Now, whether we can achieve this is not something we can control. Now we have to identify the medical organizations that are willing to take part across the boundary, and they have to have the computer system linked up before this can happen. As regards the drug formulary, we like to include more drugs, and in the policy address we will set aside more resources for the hospital authority to incorporate more new drugs into the drug formulary. As to whether they can be so incorporated will depend on the established mechanism of the hospital authority. And this is an important mechanism. I'm sure that internationally a lot of jurisdictions are using the same system. That this is not something of our own making. We have taken reference from the UK and Australia. They have a committee, and it has to conduct the scientific research, and if there is some medical literature that can prove the efficacy of a particular drug, then it can be incorporated. This mechanism will continue to apply. Now we have to have this mechanism to make sure that the taxpayers' money is used appropriately. There are 7 members: Yu Si-wing, Albert Chen, Yu Si-wing, Chen Kim-po, and Elizabeth Quat. Mr. Yu, Chairman, I've been to the public hospitals, and I find that for the conventional hospitals, even the corridors are full of beds. According to the PA, in the 15-16, there will be an additional 250 beds in the hospitals in Hong Kong. Do we have enough space in the hospital settings for these beds, or do we have enough manpower? If we just increase the number for numbers' sake, then there may be a gap somewhere. Second, now for the specialist hospitals, specialist wards in public hospitals, some of the beds are manual. They are really old type of beds. There are many patients who are chronic patients, and they have mobility problems, and it will be difficult for them to ring the medical staff to adjust the beds for them. I think that the beds should be automatic, and it would be easier for these chronically ill patients. Are there any plans to replace the old type of beds to beds that adjusted automatically? Third, about the testing center for Chinese medicine in 2015, and this will happen. According to the Chinese medicine community, they are concerned that there would be an across-the-board arrangement for them to follow the international practice. Now, my question is, how long is it going to take for the entire process for us to follow the international practice? And are there any plans to get all the practitioners prepared? Secretary? Yes, indeed, and a number of beds. For those measures that in the policy address, they have been discussed between us and the hospital authority. They must have the manpower before this is proposed. Whereas, as a matter of fact, if there is more space, we would have liked to have more beds created. But this additional number, reflect the amount of space that we have available. As to the other questions, the hospital beds, I defer to Dr. Leung. Now, turning to the third question, we don't have any intention to make a connection between the GMP and the testing center for Chinese medicine. Of course, with this testing center, it would be beneficial for the development of Chinese medicine in Hong Kong. Perhaps Dr. Chen might wish to supplement in just a moment. Dr. Leung. Chairman, thank you. Now, for hospital beds, some of them are pretty old. They're still manual. I'm grateful to the Jockey Club in this regard. We have 10,000 or more beds that have become automatic. In the coming couple of years, we will replace them gradually. We have the resources. It's just a matter of time, and we do need to call for tender. Now, for the hospital beds, some of them cannot be automatic, like the psychiatric beds and so on. We do have the resources available. It will take a couple of years for them to be replaced in phases. Mr. Albert Chan. Chairman, thank you. Chairman, our Chief Executive is busy putting up his own salaries and setting up the Hong Kong Army Corps, and many are suggesting that the government do more for the senior citizens, like the dental care and so on. It should be done in a more expeditious manner. Now, every year, 5,000 or 6,000 senior citizens simply cannot make it. They don't live long enough to see the dental care provided to them. A lot of them suffer from really atrocious dental decay. They simply cannot eat anything with the teeth. The dental care and dental treatment would be important. If the government doesn't do it themselves, perhaps under the CCF, you can make a massive injection to expedite dental care for the elderly. Perhaps you might wish to come up with a number, and how many years would these be phased in? I don't think it's a good idea for you to do it on a year-by-year basis. Perhaps the Secretary might wish to do something that you are perceived to be a principal official who is more concerned about the well-being of the people. I hope that you will not copy what 89 does in putting up his own salaries and setting up this Army Corps. Second, that there is an imbalance between districts regarding hospital services, and there are Anti-West, for instance, it has the lowest allocation in terms of population, in terms of the medical staff, but it has the longest waiting time. Let's take specialist outpatient services and so on. The waiting time is particularly long. So in relation to dental care for the elderly, will you do a better job? And in terms of an imbalance between the hospital or district clusters, will there be any undertaking to redress this imbalance, which is historical legacy? Secretary, yes, dental care for the senior citizens. We appreciate the demand for that. At the present moment, through the Community Care Fund, a great deal of resources have been devoted. It's not simply a question of resources. It's a question of the number of dentists. We have about 300 or so dentists who have been lured to this CCF scheme. This is the result of our cooperation with the Hong Kong Dentist Association, and through the association they managed to mobilize 300 or so dentists. But we're not dealing with the examination for the senior citizens alone, and we do provide dentures for them if necessary. So the number of dentists would be pretty high, Mr. Chen. And can you have a number for us? You don't have to wait until the elderly people to get worse. Well, we hope that 130,000 senior citizens will be served. We have 300 dentists serving so many senior citizens, and you can imagine the time that they spend on the senior citizens is pretty high. Now, Mr. Chen talked about the clusters. Mr. Chen, what the Secretary talked about 130,000. If you refer to para 14, there are about 1,100 elderly people who receive the treatment. We increase the number massively, that they simply cannot live long enough to wait for the service. Right? Perhaps Mr. Yu will supplement in just a moment. Now, we have a steering committee on the review of the hospital authority. The questions that most people ask would be the balance between the different clusters. After review, as I said, the review is is near completion, and we're collating all the views at the present moment. Once the views have been collated, we will put together the final report. Of course, I don't want to preempt anything at all, but I can anticipate that between the clusters, the balance between them, the power and so on between them, there would be a recommendation in this regard. And obviously, we will ask the HA headquarters to play more of the coordinating role to make sure that the policies between the different clusters can be coordinated properly. Perhaps Mr. Yu can supplement. Chairman, regarding the dental care for the elderly, we started from scratch. At the moment, we have two programs. The first one is the outreach program for dental examination for the senior citizens at the RCHEs. The second one was introduced last year for those who are in receipt of the home care services. They will be given free dentures. The senior citizens, if they are too old, they are not prepared to accept this kind of service. In the light of our experience, for those who are receiving home care service, we provide them with free dentures, and in the long run, we are extending these to those in receipt of OALA aged 70. The number is in the tens of thousands. It's not a question of money. Do we have enough number of dentists? These are the questions that have to be addressed. We talked with the Hong Kong Dentist Association. It is difficult for the government to recruit all the dentists, and they're not prepared to stay if all they do would be to provide dental care for the senior citizens. So we have the program whereby the dentists and private practice would be joining the program. We have 300 or so dentists in the program at the present moment, and we can have 10,000-20,000 per year if all these private dentists are joining. So the CCF did discuss with the Dentist Association. We should have €80 as the starting point.
And we mustn't ask the senior citizens to approach dentists themselves. We're going to set up a central registry for senior citizens to be matched with a suitable dentist. We hope that by the middle of this year or the second half of this year, this can be implemented. And experience will help us in, first of all, promoting the scheme to private dentists for them to join, and secondly, after completing the program for those aged 80, we can lower the threshold to 70 years old, for example. We have just 1,000 plus dentists in the private sector, so we can't really increase the number unless we play magic. Well, Mr. Albert Ho, about the new hospital in Kai Tak, you say that the first phase project will be completed by 2020 and an oncology center will be set up. As for emergency services or A&E, you did not give any answer on this and you did not even give us a timetable. So why isn't there a timetable for a project of this scale? The other point is, before the new acute hospital in Kai Tak is completed, the A&E services in Queen Elizabeth Hospital will be affected or not. Can you guarantee that it will not be affected? I'll ask Dr. Lang to take your question, and if necessary, I will supplement. In planning for the new acute hospital in Kai Tak, as I said just now, at this initial stage, there will be 800 beds, and it will be completed by 2021. And in the planning process, we'll also plan for phase 2, which will include emergency services and an A&E unit. And Mr. Albert Ho's question was very true. So the Queen Elizabeth Hospital's A&E unit will not be affected. It will not be affected at all. What about the timetable for phase 2? Well, for phase 2, we can't provide a timetable yet. It depends on the development of phase 1 of the Kai Tak Hospital. And this will also be tied in with the development of the whole district. That is the whole service model, and we need to look at the whole cluster. So we're just looking at phase 1 of the hospital. And within this year, we hope to form some more ideas on phase 2 of the hospital and report to members in due course. As for inpatient and ambulatory services, in the new hospital, as QE will be redeveloped, the services in Kai Tak will be taken up by the staff in QE, and these two hospitals' delivery model will also be reviewed. Well, I recalled at an early stage you plan to have a children's hospital. Do we still have this plan? Well, these are two different hospitals. We have this children's hospital. My question is it part of the Kai Tak Hospital? Well, perhaps let me explain the history of the two hospitals. In the new Kai Tak district or development area, originally 3 hospitals were planned. The first one was a children's hospital, and earlier for the children's hospital we went through some procedures. Before I took up office, while the tendering process was about to begin, and soon after I took office, the funding was approved for the children's hospital and construction is underway. And we also have 2 other hospitals in the pipeline. One is a geriatric hospital or neuroscience hospital. And the other hospital was a hospital of a smaller scale for public-private collaboration. After I assumed office, however, we reviewed the situation. If we consider the small-scale operation of the hospital and the circumstances in Kai Tak, we actually need a bigger hospital. So instead of building a complex for neuroscience, we did away with this concept. Apart from the children's hospital, the construction of which was underway. The sites should be combined to have a larger hospital, which will also include the neuroscience center. So we're talking about a 2,000-bed large-scale new acute hospital in Kai Tak, together with a children's hospital under construction. The hospital cluster in future there will provide a large number of hospital beds, and we need to plan its construction by phases because we have never had such a large-scale acute hospital before. Chairman, my question was this: why can't we have a holistic timetable? Because in designing this hospital, apart from the initial operation, it also has to do with deployment of staff and the QE hospital, so the process will be quite complicated. Mr. Chan Kin Po, whether or not we have this voluntary health insurance scheme, we have over a million individual policyholders and some 2 million group policyholders. And according to the policy address, the number of hospital beds will increase to 250, and I'd like to know more in the long term how you're going to prepare for the implementation of the scheme. P.S. We fully understand Mr. Chan's question. So we're going to expand public hospitals. At the same time, we also want to expand private hospitals, but it's not up to us. We need the private hospitals to work with us. First of all, for Wong Chuk Hang, there will be a hospital which will be completed in 2017 and 18, providing some 500 hospital beds. At the same time, the Chinese University of Hong Kong also has a private hospital in the pipeline. The progress is satisfactory. We believe in a year or two after 2017 and 18, there will be another 500 hospital beds available, if everything goes smooth. So altogether, there will be 1,000 hospital beds additional beds. So we see at the same time, private hospitals are expanding with more, with new hospitals and more beds. So in short, we have 4,000 hospital beds in private hospitals in the coming 5 or 6 years. We anticipate that the number will increase by 1,500 to 2,000. So altogether, in the coming 5 or 6 years, some 40 or 50% increase will be seen. But it's not just about numbers, because one of the major idea of health insurance plan is for ambulatory procedures or CT or MRI procedures. Because of the insurance policies, these patients are required to take these procedures in the private hospitals as inpatients. Once we have the scheme, if insurance can still be provided without having the patient to stay overnight, then in a short time we can alleviate or address the demand in the private sector. OPS, you say that this can be, those procedures can be performed in clinics instead of hospitals. The insurance sector is well aware of this, but the insurance sector is not happy with procedures being taken in clinics because of various risks. Now, for major insurance policies that have a 40 to 50% market share, they are also advocating the same, because they're also finding a way for patients to save money and for things to be more cost effective, and this will be beneficial to all. As for the private hospital proposed by Chinese University of Hong Kong, it has inpatient as well as outpatient services. Is that right? For the Chinese University's hospital, this will be a private hospital, but this will be managed by the Chinese University of Hong Kong. Operationally, it may work with or as another teaching hospital, just like the Prince of Wales. But in terms of its nature, it's a private hospital. So in principle, the hospital will take private patients only, but not only those who can afford costly medical bills. Well, your question is very good, because when the CUHK first floated the idea to us, they made it clear that they are not trying to build a luxurious hospital, but rather to set up a private hospital that can tie in with the healthcare reform in Hong Kong. That is to say, it will be a hospital for the middle class. So there will be general wards, yes, private general wards. We are going to discuss this item at the next meeting anyway. Mr. Chan Han-pang. Thank you, Chairman. Well, in recent years, I feel very concerned about two situations. One is about NT West. We have sufficient hospital beds, but not sufficient doctors. For Pok Oi, for Tung Chung Hospital, for example, they do not have sufficient doctors. The other phenomenon is that there is a high turnover rate in HA. Many HA doctors practice in the private sector instead. So once we roll out the health insurance scheme, will the situation of experienced HA doctors leaving the public sector be more serious, so that patients going to the public healthcare sector will be consulted by or will consult inexperienced doctors only? Are there measures for HA to salvage experienced doctors, so that for public hospitals or there'll be doctors willing to serve in the public sector? And the second question has to do with Chinese medicines. Now, the government is going to plan for an aging population. Now, in this year's policy address, it said that you will step up promotion of the HKCMMS project, the Hong Kong Chinese Material Medical Standards. But according to scholars, they suggested that much of the early part of this project was actually done by them, and a testing center would be set up by the government to take up this project. Can you say more about this? And in mainland, we have a herbarium, and there have been much studies, and the herbarium has been much applied. Now, what about the HKCMMS project? How will it be applied? Well, I'll ask Dr. Leung to answer the first question, and P.S. to answer the second question. Dr. Leung. Now, about doctors. Now, Mr. Chan's point is very sound. From our experience, if the private sector is prosperous, many doctors would prefer private sector instead. But of course, we have implemented a series of measures. We have step-up training. We have also been able to attract experienced doctors to work in the HA as part-time doctors. We have some 300 doctors at the moment, and we also have training for doctors. We also have facilities, for example, mechanical device a mechanical arm for use in operations, so as to attract more surgeons to stay behind. And we also looked into the proposal of inviting retirees or retired doctors to work on a longer basis rather than just part-time. And we're conducting a review in the middle of this year. If we're able to attract retired doctors to work on a more long-term basis, but what if because of the health insurance plan, the private sector may be prosperous and doctors may prefer to work in the private sector instead?
Well, it is attractive to work in the private sector, but for doctors to stay in the hospital authority, some of them stay until their retirement, and they prefer working for the hospital authority. And I did ask them about it. Now we have the children's hospital, the pediatrics, are very experienced. They asked us whether they can stay for the children's hospital, and I hope that we can change the terms of employment so that they can serve on after their retirement at the age of 60, and that will encourage more experienced doctors to stay on to provide training. So in the coming 5 to 6 years, it is important to have experienced doctors, and we're going to have more new doctors coming on stream, and I hope that our team can see healthy development in the coming 5 to 6 years. What about the HKCMMS? Well, that started in 2002. When we first started, we worked together with a number of universities and some of the testing centers in the mainland and universities in Taiwan. That was commissioned by the DH. We hope that through this scheme, the testing of Chinese medicine can be upgraded and it can be continued in the universities. We have 200 HKCMMS. We have 30 per year, and we're dealing with the herbs. Over the years, we've had built up some experience, and they asked us to go beyond the herbs, and we do have plans to get on with this. Now, with this testing center under the Department of Health, we hope that we can increase the level of testing. Now we hope that there would be a expertise transfer once this has been up and running. All these technical expertise, we hope that we can introduce it to the private laboratories, so that the entire market, public and private, will be in possession of these capabilities. Now, there are many areas that have not been developed. We do need to devote more resources to develop this particular area. The testing center to be set up will not substitute the existing system whereby the universities are undertaking the research for HKMMS, and at the preparatory committee, we will look into all these details. As regards the dovetailing with the pharmacopoeia in the mainland, the traditional medicines are favored increasingly in Europe, in the UK, and they have their own pharmacopoeia, and in order to increase or raise the level of Chinese medicine, the HKCMMS can or will enable the Chinese medicine to go international. We have experts from all over the world who are studying herbs and Chinese medicine. Some of them are sitting on the pharmacopoeia committee in other jurisdictions conducting the research. With this center, we hope that we will expedite all the work in relation to Chinese medicine. Dr. Fernando Zhang, Chairman, I think something has been done in the policy address regarding healthcare. I mean, it is nonetheless tinkering around the edges. We have the dental care, the hospital, the testing center, bit of everything. I mean, this is all well and good. But at the end of the day, we have a bit of everything, and nothing is all sufficient. The other thing, the thing that I'm concerned about is the cooperation between the NGOs and the medical sector. The population is aging. Report number 62 points out that we have 1.37 billion chronically ill patients. I would like to hear from the Secretary regarding disabled people, chronically ill patients, and elderly, the long-term care policy is of great importance. I haven't seen any long-term care policy that has been formulated in Hong Kong. The LWB doesn't seem to be willing to take on board this idea, although they are dealing with a lot of the services. The DH, or the Hospital Authority, are providing services in this regard. And they have the program for the elderly, and we are pushing for a long-term care program for rehabilitation. The Secretary, you are conducting a plan for the manpower. All these are closely bound up with one another. Now you have representatives on these committees, and there is a gap in terms of timing. Now we're not sure what path Hong Kong is headed down, and you are really doing your own business. We don't have any cross-bureau platform looking into this particular area. So, Secretary, my question for you is, are you going to have a longer vision in terms of long-term care? Are you going to do something about the situation? The Secretary has set a number of important committees that are doing a lot of things. Now, this term of government has more than halfway through now, and long-term care is a pressing issue. I think you ought to get started with this issue. If you look at the paper, things are so fragmented. The welfare services, dental care, the testing center, the ambulatory hospital, the geriatric health assessment, everything has to do with the long-term care. Are you going to piece together all these bits and pieces? Secretary, Chairman, we are concerned about the importance of cooperation between the NGOs and the healthcare sector. Perhaps my colleague can elucidate on what we have been doing. Now, Mr. Cheung, of so many committees, we have the review committee on mental health. We are particularly concerned about the aging population. Now let's take the mental health, for instance, for geriatrics. Now what we are concerned about is that the intellectual disability. Now Mr. Cheung raised this particular issue. This doesn't simply involve the healthcare sector. It also involves the other organizations to do with rehabilitation. We have to bring them all together. So we have set up a committee specifically looking at the geriatric population that is suffering from intellectual disability. And we have to look at the existing facilities, the manpower, the training, and also the mode of service provision and so on. And Mr. Yuen might wish to supplement. Chairman, thank you. Now, with the aging demographics, the healthcare would be an important aspect. Of course, they do need other kinds of services. Mr. Cheung is aware that under the Commission on the Elderly, they are looking actively at these issues. Now, when talking about the long-term care, what are we doing at the moment? Now, in the medical wards in hospitals, each summer and winter during the height of the flu seasons, because of their chronic illnesses, many senior citizens are going in and out of hospitals. I mean, you simply cannot build your way out of the problems. Now, those aged 60 and above, the hospitalization rate is higher than those below that threshold. So it is important, like Mr. Jones said, to have collaboration between the NGOs and the healthcare sector. So there should be coordination between the RCHEs and the hospitals. When senior citizens are weak and old and infirm, a lot of them are already institutionalized in the RCHE. So the old folks' homes have to do two things. The first one is the facilities, the hardware, whether this can be improved so that the senior citizens don't have to go into the hospital so readily. Second, the medical ward in the hospital can achieve the purpose of providing outreach service. We don't really want to make the senior citizens go back and forth between the hospitals, A&Es, and the old folks' homes. We can have the sick bay and these kind of facilities where the outreach doctors can provide the services. As a next step, we can take advantage of the community doctors, and that would enable us to take full advantage of the resources available. Second, as the Secretary said just a moment ago, we can have the PPP program. 3 districts are covered. Going forward, we're going to extend this to the remaining 15 districts, specifically targeting at the senior citizens. If we can collaborate with the community doctors, better services can be provided, and senior citizens do not have to do so much traveling. And we can promote the family physician concept. In terms of manpower, we are conducting a long-term plan regarding the manpower. We are working in conjunction with the SWD. One of the input comes from the SWD regarding the long-term care needs on the part of the senior citizens, and also the positioning of the RCHEs might need to be changed. Now we're going to see hundreds of thousands of senior citizens who are suffering from intellectual disability. And what they need is not so much medical care, but rather home help or home care. At the moment, we are liaising with the RCHEs to see whether these kind of services can be provided. Now, once someone is suffering from intellectual disability, we formulate a care plan for them, and they would be able to receive the services at the care homes. We are liaising with the CUHK regarding a long-term study to see how we can encourage better cooperation between the NGOs and the healthcare sectors. And the community on the elderly is really doing the coordination. We attach a great deal of importance to the healthcare needs of the elderly, but as the population ages, senior citizens need community care in addition to healthcare services, and the support in this area would also be terribly important.
You can wait for a second round. Dr. Elizabeth Clark. Thank you, Chairman. Now, I'm very concerned about healthcare measures, and I know that there will be a teaching hospital in Sha Tin, and I welcome it, and there will be a major hospital in Kai Tak, and I welcome it as well. But in the past, we have had the experience of having the hardware but not the software, just like the obstetric services in Cheung Kwan O. We have the hardware but not enough doctors. Now, I understand the government is conducting a comprehensive review or planning to look at the territory-wide healthcare needs in Hong Kong. So when are we going to see the result? For example, on the number of doctors available, how many doctors are being trained, how many doctors are going to private sector. I'd like to know more about that. Now, on the other hand, the DAB has also proposed a screening for breast cancer. Now, this is not included in this year's policy address. I understand, the Secretary, you're very concerned about breast cancer as well. I'd like to know whether there is any progress. And also about genetic diseases and rare diseases. The DAB is proposing that a database be set up to promote the research and development in this regard. Now, I wonder if the government will also consider it as well. And also for common genetic diseases or prenatal screening, whether we can adopt the latest technology such as T1, and the government has not yet responded to our suggestions. So these are my questions for the time being. Secretary, first question, for long-term planning, we're talking about two aspects. First, on manpower, and I think I've answered that question earlier. Now, we have a committee to review the situation. If you're talking about the major disciplines such as doctors, nurses, dentists, we have completed this core part of the review, and we're going to put forward our recommendations in the middle of this year on manpower planning for these disciplines. On facilities, as I mentioned last year to the panel on health services, that in order to meet the needs of an aging population 3 decades later, for each hospital cluster, we should plan for each hospital, its beds and other facilities. That is why we are going to have large-scale children's hospital in Kai Tak. I'm also concerned about breast cancer. Now, in recent years, we have been placing our focus on preventive measures. So last year, we proposed free screening for colorectal cancer. This year, we have proposed measures for early identification of inborn errors, and that the test involves extracting something from the fetus for the test. As for breast cancer or mammary glands cancer, so far we don't see any evidence in promoting a territory-wide screening exercise. And last year we worked with the DH and universities and HA in a study. We hope that sufficient data can be collected to see whether it will be effective to promote a territory-wide screening for mammary gland or cancer. We have a research fund, and we're going to invite a tertiary institution to take up research in this regard. As for the screening for inborn errors of metabolism, I mentioned it already. As for T21 test, about a database of rare diseases, well, maybe Dr. Leung can supplement this later. As for the prenatal T21 test, we have other ways to do the test. And we also encounter some difficulties in considering whether T21 prenatal tests would be effective. And some disputes over intellectual property is still ongoing. And therefore, in the process, we need to clarify some legal issues and also whether the test is effective. And Dr. Leung perhaps can supplement about a database for rare diseases. I don't think it is easy. The first step is, according to the policy address, deal with a study on the identification of inborn errors of metabolism, and the DH has already set up a working group with us. And we hope that by the end of this year we can come up with some result of the study to identify inborn errors. And for other areas, we need to set up other special working groups. As for other screening tests, well, we have been communicating with the CUHK in the coming years. We have discussed with the CUHK on the transfer of technology. Secretary talked about the IP, the dispute over IP issue. We're going to consider it, and for the new hospital, it will use the T21 technology. And some specialist doctors from HA have been seconded to CHK to acquire the skill. We have some technical problems at hand, but we're not going to sit and wait. We'll get everything ready, including manpower, so that once it can be kick-started, we can just implement it smoothly. Well, I'm sorry, but he hasn't answered the question on breast duct cancer. Well, he already answered you. It's being studied. First, we'd like to find some local data to support, to either support or not support this work. This is controversial. Otherwise, I would not have chosen colorectal cancer screening first. I'm not in favor of any particular area, but we need scientific evidence to support its effectiveness. Mr. Wong Ting-kwong. Thank you, Chairman. In the past decades, we have seen some developments in the healthcare sector. I have two questions. I think these two questions are quite a shock. Well, now we have hardware. We have all the hardware ready in our healthcare sector, and in Para 189, a general hospital in Kai Tak will be commissioned. It will be a large-scale hospital with 2,000 hospital beds. So, as many members mentioned just now, we have all the hardware, but we don't have software, and it is very important that we resolve the manpower problem, including doctors and nurses. Now, Secretary, have you considered importing doctors and nurses? Have you considered it? Apart from having issues with professional bodies, there may be issues with the labor sector. But have you considered it as a solution to the problem? We cannot sacrifice the health of the public because of the sexual interest. So we need a solution to address the problems. That's the first question. Secondly, in Para 194 of the policy address this year, it talks about a testing center for Chinese medicine. Now, when it comes to Chinese medicines, we need Chinese medicine practitioners. In this year's policy address, little has been mentioned about Chinese medical practitioners. apart from Western medicines, Chinese medicines is also very important. In the mainland, they do not have a clear division of Western and Chinese medicine. In mainland hospitals or mainland Chinese hospitals, sometimes Western practices may be used. So about the integration or collaboration between Chinese and Western medicines, Secretary, have you considered how these two disciplines can forge a closer tie? These two questions involve a major principle because it hinges upon the vested interest of Western medical doctors. Have you considered it? Thank you, Mr. Wong, for your question. On manpower resources, the HA has repeatedly stressed that in recent years, in particular, around in July, when they have a stock-taking exercise, they find a vacancy of 200 to 300 vacancies for medical doctors. Well, in some years ago, because of other reasons, we reduced the number of places in the medical college. Well, but that might not have been the only reason. Increase in demand might have been another reason. Now, about what we can do, on the one hand, we must step up training for local doctors and nurses. On the other hand, we're talking about importing doctors and nurses. In around the middle of this year, we are going to announce the result of the review on healthcare manpower in so far as doctors, nurses and dentists are concerned, and whether there will be any recommendations or increase in the number of places. Now, as for importing doctors, we have been working on it in the past 2 years. But in order to successfully import a doctor, so to speak, the doctor will need to go through a licensing examination. This is the international practice that the licensing examination should be conducted. And we have been working with the Medical Council, for example, by increasing the number of licensing exams from once a year to twice a year. And the passing rate in the, recently has also gone up. But as we understand, some returning doctors may not be used to the model of examination, and we're discussing with the Council on how to improve or reform the examination model. Because it doesn't sound right if doctors' examination results are affected because of the mode of examination. And for licensed doctors, we have also relaxed the internship requirement. So every year the HA recruits overseas trained doctors under limited license, and in the coming 5 or 6 years, we should be able to address the issue of shortfall of doctors and nurses. On Chinese medicine, Mr. Wong is right. This year's focus is on a testing center for Chinese medicines, but let's not forget that in last year's policy address, a site was already reserved in Tseung Kwan O for a Chinese medicine hospital. This year we have not repeated this because this year we're going to roll out a pilot scheme in HA on the integration of Western and Chinese medicines in Hong Kong, in particular in hospitals.
Mr. Wong said in the mainland there is a blurred division between Western and Chinese medicine. But some Chinese medicine practitioners from the mainland told me that because of the blurred division, they're free to use Chinese medicine as well as Western medicine. And a lot of Chinese medicine practitioners would use Western medicines as well. And they are looking at Hong Kong, where we are trying out a model which can preserve the traditional benefits of Chinese medicine, but at the same time we can tie in with the Western medicine and Western medical practice, which is in line with international practice. And we'll see how this can be introduced in the Chinese medicine hospital. Now, this exercise can be completed this year, and thereafter we will consider. We will have a clear idea how soon the Chinese medicine hospital will be implemented. Next, Ms. Alice Mack. 5 minutes, please. Secretary, colleagues put questions about the dental care. Secretary, the FTU did propose. In fact, the elderly voucher scheme has seen an increase in the total amount. But many senior citizens would rather save the vouchers for common cold and so on instead of the dental problems. They rather put up with the dental problems. So will there be a separate voucher scheme for dental care for the senior citizens? Second, now we're going to have the VHIS. Billions of dollars will be spent on the high-risk pool, but for the remaining $4.7 billion, how are you going to spend on $4.7 billion? How are you going to spend this amount of money? Will this be spent on private hospital or any other kind of services? The $45.4 billion. Secretary, well, I think we have to look at it from two angles. Now, if you're talking about general dental examination or toothache and extraction and so on, it doesn't incur a considerable amount of resources. It would be similar to the need for primary care. There should be enough sufficiently covered by the voucher scheme. Ms. Mack said that the senior citizens don't want to go to the dentist. I think you are talking about the dental problems that would incur more resources like dentures and so on. Indeed, if you give them a voucher for $1,000 for dental care, and this is all they get for 1 year, and a denture would cost them anything up to a few $1,000s. So as we said, for those needy elderly who cannot afford these more expensive dental treatment, we will see how effective the CCF program is going to be. Now, as regards the $50 billion, we're going to spend a few billions of dollars for the high-risk pool. In the consultation document, there is a reference to the $4-point-something billion, and that's an amount for a specific period of time. By the time this scheme is in place, we're not sure how much it's going to be, maybe more, but it will be something like a few $billion. Now, of the for $50 billion, how are we going to spend the remaining $40-odd billion? Now, some of the money, some amount will be set aside and put into a fund. Now, as to whether it is a fund or whether it is a separate account, we haven't quite decided yet, but this amount of money set aside will incur the interest, which will pay for the PPP program. The hospital authority does have different PPP programs, and they are subsidizing patients to go to the private practices, and this will be beneficial to the patients. Once they've left the hospital authority, does it mean that the HA has made some savings? The answer is no, as you can imagine, because the HA does have a waiting time, does have a queue for different disciplines. Once they've left, those on the queue will be taking their places, so that the HA hasn't made any savings at all. Once PPP programs are introduced, we do provide the resources. So if we can set aside an amount of money for the HA to introduce the PPP programs, then it would be helpful to the entire reform exercise. But that will not use the entire amount, and that's true. But for the time being, we haven't quite decided on how the rest of the money will be used. The idea is not to use up the amount of money, but rather how this amount of money will help with the healthcare reform. If the money is not used, then it will still be in the coffers. Now, we are collecting a lot of money from the Financial Secretary. Now, let's take the Kai Tak Hospital. It will cost us $20 billion upon completion. As regards helping the tertiary institutions to build private hospitals, we're not dispersing the money for free. We are helping them only, and there is a mechanism for us to offer the loans for the private hospitals. Dr. Elizabeth Quat. Chairman, thank you. I'd like to put a question regarding the Phase 2 program for Prince of Wales Hospital. Now, this is very much a disastrous area. Now, with the land available, I heard that they are looking for land, further land in Sha Tin. What is the latest in this regard? Well, I'd like to say something in principle first, that Dr. Leung might wish to supplement later. In principle, we are fully aware of the demand for medical care in NT East. Now, for PWH, they have completed the first phase expansion, and as soon as this was done, there was really a shortfall of hospital beds. In the light of this, once the first phase extension has been completed, we are looking at Phase 2 extension together with the hospital authority. We are proactively looking at the advance work planning. Earlier, we put forward a blueprint to the panel, like in Tai Po, for instance. The land set aside for private hospital was given back to the government, but in Tai Po Hospital and Nethersall Hospital, or between these two hospitals, there is land set aside or reserved, which is now used for car parking purposes, and this will be used for extension purposes. So in NT East, we do have the long-term plan to extend or expand the existing facilities to meet the demand from NT East. Dr. Quat, if I may put a question about the health issues of children. From newspapers, we learned that children do not have a healthy lifestyle. They are suffering from lack of sleep, and they're eating in a way that would cause obesity. If they cannot maintain good physical and mental health when they're young, that they will be storing up trouble for the future. Now, the policy address is silent on any measures regarding the physical health of the children. What measures do you have in this regard? Secretary, it would be difficult for me to talk about this in just a short space of time. In fact, the DH does have a pretty successful program, which is looked at by other jurisdictions, and that is the health protection scheme for the children. Once we identify the problems, we provide services for rectification. Now, there is no dental care overall, but we do for the whole of Hong Kong, but we do have a pretty good dental care for children. Dr. Kwok mentioned obesity. That has to do with the inactivity and the diet and so on. In fact, the DH, through a committee on the prevention of communicable diseases, has reached out to the schools, and through the dietitians, they are providing guidelines to the schools regarding lunch boxes to make sure that they are up to the healthy standard. Now, this year, we have started some programs, not so much for children alone, and that is to reduce the sugar and sodium level in food. For children, in a lot of the food that they consume, particularly the prepackaged drinks, the sugar level is pretty high. The children don't have pretty high enough awareness, and the family members don't really realize the harm that this is causing, like soft drinks and fruit juices and so on. They're consuming a lot of these kind of beverages. We are going to set up a high-level steering committee led by the DH and the Center for Food Safety to reduce the level of sodium and sugar in the food consumption. And I think that would have a great deal of impact on young people. Smoking is also having a great deal of impact on young people. Smoking may be a problem for the adults, but in fact the children are also similarly affected. Children between P3 and P6, there is an increase in the rate of smoking among them. We will step up our work. There are different types of smoking that will be attractive to young people. We will look at these as well. Dr. Kwok, I'm glad that the Secretary is showing so much concern for the school children. I hope that more will be done going forward. Many parents are concerned about the high medical bills for children, that they have to wait for a long time at A&E if they are taken ill, and they have no alternative but to go to private practitioners. The DAB urges the government to introduce a healthcare voucher for children, like $1,000 per annum and so on. Secretary, well, in the annual planning, we are prepared to consider that, but for the time being, we don't have any decision yet. All right, so much for this item. We have about 5 minutes, and let me put my questions. Secretary, you mentioned that there would be rehabilitation and convalescence services for the senior citizens. Many senior citizens would like to spend the twilight years at home. How are you going to step up this kind of service? And will you be devoting more resources for the senior citizens to spend the twilight years at home instead of in an institution?
Chairman, now on this point, when Permanent Secretary was talking about care for the elderly, he talked about the work that we had done For palliative care or care for the terminally ill, maybe I'll defer to my colleagues, but let me say this on behalf of the PS. As for how we can give more dignity to our elderly patients during the last hours of his life, we have certain arrangements. For example, work with the RCGs, and we'll give this more consideration. And we'll also follow up on various issues such as legal issues and other adaptive issues. If you're just talking about palliative care, I'll defer to my colleague to take your question. Now, as patients age, sooner or later, they will pass away, and we are stepping up our outreach effort, and the government is conducting a review in this regard as well. The HA also has professionals taking part in this review, and we are considering legislative amendments, and so that patients can spend their last hours at home, but that involves legislative amendments. And we also need to consider improving facilities in our cities. It is not good for elderly patients to travel in and out of A&E wards during the last journey of their lives. I still have time left. The other question is this. Now, in your policy address, you touch upon the mental health. You're going to increase the number of beds in Siu Lam Hospital. But as I understand, the Siu Lam Hospital takes in more patients with intellectual disability than mentally ill patients. Well, of course, you say that there is a review committee on the mental health, but I don't see much work to strengthen mental health services. How are you going to address the issue? Because it's said that 1 out of 10 in Hong Kong suffers from mental illness. Now, let me say something about the review committee on mental health. We understand that there are different disciplines under mental health. First, for mental health services for adults, we face two serious problems. One is for patients with severe mental illness, and our concern is this: once a patient rehabilitates from a mental hospital, and when he is returned to the community, how can we ensure drug compliance and follow-up appointments? And we therefore have this case management program implemented a few years ago, and in the past few years we have been increasing manpower to extend the case management program to 18 districts. Apart from severe mental illness, we also have another problem with moderate or patients with moderate mental illness, because there are many patients with moderate conditions, and through years of public education, stigmatization is not as severe as before, and more members of the public are willing to consult a psychiatrist. And this problem has to do with an increasing number of patients with moderate mental illness. And we also have this in mind, and we must not just rely on psychiatrists. So our direction will be to place more emphasis on primary care and family doctors and frontline doctors to deal with patients with moderate mental illnesses at the primary care level. Well, the other issue has to do with elderly patients and children. For elderly patients, I mentioned dementia, which is the major problem, and we've set up a working group to explore the service model best suited for Hong Kong's situation, and we are going to step up training and implement other supporting measures. For children, when it comes to mental illness, we're talking about two major types, one with intellectual disability, the other with other conditions such as autism and dyslexia, and we have different approaches to these problems. In the policy address, as far as social services are concerned, we step up our services through NGOs, and responding to your point just now, well, of course, some mentally handicapped children may still be suffering from the same condition when they grow up. So we're also talking about institutional care for them. And having discussed with the HA, we are quite confident that by increasing the number of psychiatric beds, basically we can deal with the problem of long waiting time. All right, so much for the policy address briefing. And thank you, Secretary and your team, for attending the meeting and discussing the issues with us. Now, thank you. The next item is expansion of United Christian Hospital. So would everyone get ready for this? All right, this item is on expansion of United Christian Hospital, UCH. And this is a proposal which will be submitted to the PWSC and FC. So, members, if there's a need to declare an interest, please do so. And may I welcome the administration and the representatives who are coming in for this item. I think this is very clear. So maybe. Well, I do have a brief presentation, so let me walk you through it. Chairman, members, this paper seeks members' support on the proposed main works for the expansion of the UCH, including demolition work and foundation works. As members may understand, the UCH is a general hospital that serves inpatient and that provides inpatient ambulatory service in the Kowloon East cluster. In recent years, the growing and the aging population in Kwun Tong have given rise to an increased demand for both ambulatory and inpatient services in Kowloon East. And there is a need, therefore, to expand the hospital to cope with the rising service demand. And the proposal is as follows. The 3 existing hospital blocks will be demolished, and there will also be a day service block, a new one, and another wing will be added to an existing block. And the service capacity will be increased on expansion of the hospital, and supporting services can also be expanded, and the other services can also be improved, expanded, or rationalized. We'll also increase the level of services, and for phase 1 of the project involving preparatory work, it commenced in August 2012. In relation to the detailed design stage and the master plan, this is underway. In considering that the construction is a large-scale one with complex construction work involved, in order to monitor and minimize cost risk, we propose to phase the implementation of the main works to minimize the risk of cost overruns. And we propose to demolish the existing 3 hospital blocks and the another block, the foundation works, site formation works, excavation, electoral support works, etc. That involves $1.79 billion. So with member support, we're going to submit funding application to FC for funding approval. And subject to the funding approval, we're going to commence the demolition and substructure works immediately, and it's expected to be completed in the, December 2019. Following that, we are going to meanwhile, we're going to report to LegCo on our progress. I seek member support. We have 3 members, Poon Siu Ping, Alice Mack, and Elizabeth Quat. Mr. Poon Siu Ping. Now, about the increase in population, according to your information, it is going to increase from 1.08 million to some 1.19 million. So, between 2013 and 2021, on average, there'll be an increase of some 12,000 per year. We support the expansion of United Christian Hospital to improve services. But I have some questions. I recall in 2012, in this panel, we discussed that the number of hospital beds will be increased from 1,400 to 1,700. Now, according to the paper, there'll be 1,960. Is this the exact number? And also, you mentioned that in the second quarter of this year, you're going to submit funding application to FC. Now, population will continue to increase. The whole project will be completed in when? 2023, right? So, with the annual increase in population, and of course, there'll be other hospitals providing the same level of service. My question is this: there may be delays and slippage, and as far as construction is concerned, will there be any remedial plan? There could be factors causing the delay, such as filibustering or inclement weather and other factors. Is there any contingency or remedial plan? Thank you, Mr. Poon. On hospital beds, 1,960 beds includes beds for daycare or day beds. Because after demolishing the existing blocks, we're going to build a large-scale day hospital, and there will be day beds for ambulatory procedures. The second question about construction. Now, in terms of the overall design and the timetable, the HA would like to have the members' support and the community support, because with your support, we're going to submit application to FC for funding approval in order to meet public aspiration. And as mentioned by Mr. Poon, because of aging population and the rise in population, many are looking forward to the expansion project, in particular our Department of Oncology or the Oncology Center. So we seek member support so that, in particular, when the proposal reaches FC, things can be smooth. Dr. Choi, would you like to tell us the impact should there be a delay? Thank you, Chairman. Now, our cluster is looking forward to the expansion project because of the synergy effect that we now have and will have. And every year we will plan according to our overall service capacity. And our 3 hospitals, namely the hospital, the UCH Cheung Kwan O and Haven of Hope Hospital, will ensure that the same level of service be maintained. Ms. Alice Mack.
The FTU is in support of this project. Would like to see this through the FC as soon as possible. Now, why is it that the funding proposals are split up into two phases? First of all, blocks FGH and P will be demolished, and a new block will be built, and there would be funding proposal for the rest of the project. Now, there is so much uncertainty with our finance committee. Now, first of all, I'm concerned that the two funding proposals might delay the construction, and second, the fact that you split up the funding proposals, does it mean that you want to make it look as if the sum is not as big? Furthermore, from the residents, because of the redevelopment, your services remain unchanged, but when the residents are visiting the hospitals, some of the car park areas are closed, and there are so many people waiting for the car parking spaces during the visiting hours, and it is on a slope, and it is pretty inconvenient for people to get in and out. I fully appreciate that there will be problems during the redevelopment phases. Now, will you make it more convenient for the visitors to the hospital? Under Secretary, thanks very much, Ms. Mike. For the first question, why split up the funding proposals? Now, you would realize the sheer scale of the project, and the construction is rather complicated. We have to pull down some of the blocks, and we have to do the foundation, and we have the substructure and all the construction. So this whole project would take us anything up to 8 years. Now, for the duration of 8 years, the costs are likely to rise. And with a massive project like this, if we seek the funding for the entire project, it would be rather difficult for us to get the estimate. Ms. Mack, you must be aware of the time frame. It's not a couple of years. The entire project is going to take us 8 years. It is difficult for us to put in place the estimates. As to the second question, I defer to Mr. Lee from the hospital. The traffic and transport for visitors. Chairman, the major problem lies with the fact that the redevelopment is taking place when the hospital is still functional. We will do something about the traffic and transport. Indeed, parking is a problem. It is a problem for our staff as well, and we probably would not be able to provide the car parking spaces for the visitors. It is quite an inevitable problem. Dr. Elizabeth Quat. Chairman, the DAB is in support of the expansion of the United Christian Hospital. We hope that the second phase will be completed as soon as possible. Now, we have the non-cooperation campaign and the filibustering that are happening in the council. Now, if you queue up at the finance committee, you don't have any certainty about the funding being approved. So by the time the funding is approved, given the rising costs on a daily basis, will the amount of money sought be bigger than you need by the time the funding is approved? Now, if there is a considerable delay, how are you going to deal with this if the project is adversely affected? Do you have any fallback option? Under Secretary, thanks very much. As I said earlier, we have the timetable, we have the cost estimates. we hope that we can proceed in accordance with the timetable there. Failing that, I'm sure that the hospital authority should have some fallback option. This is very much a headache. Perhaps I defer to Mr. Lee. Tender exercise will happen in February, and we make it clear that the tender would tender price will maintain until July. If the funding can be approved this year, that it should be fine. And failing that, we will discuss with the tenderer as to whether the tender document can be extended. But this is beyond our control. Dr. Quat, well, this makes me very concerned. I mean, the tender document will be vetted until July. We're not sure whether this will get through the Finance Committee before July. This may be held up, and I hope that there will be a fallback option. If you support the project, Mr. Chairman, I think you should persuade the Pan Democrats not to engage in any filibustering. Right? Any reply? No? Mr. Ben Chen. Also, I am concerned about this. The whole thing started in 2012, and if you build in these two advanced work years, it would take us 11 years. So by the time this is commissioned, it would be 8 years from now. We appreciate the sheer scale of the project. My question is, do we have to split up the project into two? Is it possible for us to seek funding in one go? And that would save a bit of the project costs. If you split up, there will be a different pricing. And have you conducted any assessment, Undersecretary? Well, I've already explained that in brief because of the sheer scale of the project. Now, we need to spend 8 years on this project. So it is the opinion of the hospital authority that the construction costs are going to creep up in the years. So if we seek a one-off funding, it would be difficult for us to get the estimates right. And for the tender exercise, if we make it too long, there may be some risks involved. Mr. Lee. Well, even if we seek one-off funding, we still have to seek the tender twice. The foundation and the superstructure will be split up anyway. If we seek the one-off funding, by the time we get on with the tender exercise for the building work, it would be difficult to control the costs. Given the rising construction costs, if the funding earmarked is not enough, we'll have to come back for supplementary funding proposal. We did have some experience with the Caritas. There was a bit of a delay of about 2 years, so it would be easier for us to control the costs and the timing if we split up the funding proposals. Mr. Chen, the Tuen Mun residents are really getting impatient. They are looking at this UCH expansion. They are asking how soon the Tuen Mun Hospital will be extended or expanded in a similar fashion. Yes, indeed, the hospital authority has the timetable regarding the redevelopment of the hospitals. Undersecretary, now we are not talking about Tuen Mun Hospital this time, but regarding the Tuen Mun Hospital, they will expand the operating theatres first. Yes, I think they can supplement with further information. The HA did provide some papers regarding the timetable for different hospital expansions. All right, then, any further questions regarding the UCH expansion? And this will be submitted to the PWSC and the FC for funding proposal. All right, unless you have any further views, we'll refer this to the PWSC and the FC. My thanks to all the officials for being with us. Any other business that don't have any AOB items? Just a reminder, though, that the next meeting is the 16th of February. There are 3 items. On the 17th of February, between 9:30 and 12:30, there is going to be a special meeting on the consultation, or the public hearing on the consultation regarding private hospital regulation. Thank you all very much.